everyone, I'm Dr. Nimesha Gamhewage. In this video, I'm going to talk about diarrhea or acute gastroenteritis. So this is a very common problem that we see in children. This is commonly due to either a viral infection or a bacterial infection. So what you see is your child having loose motion together with some mucus in the stools, and there could be a very stinky smell together with some blood in the stools. Some children even complain about abdominal pain, and in some occasions they develop fever as well. So children contact viruses or bacteria from the food that they eat, which are contaminated, or with their dirty hands. So what is the main complication of diarrhea? And that's why we need to know about diarrhea. Because if we don't treat it well, children run into risk of developing dehydration. So this is where the fluid level of the body is not adequate and the child shows the signs of dehydration. The earliest signs of dehydration is that the tears and the saliva of the mouth dries away. And then you see that the child is passing less amount of urine. This could be concentrated. And then in final stages, you see the child in very drowsy situation, and this is a very late complication. So how do you manage a child with diarrhea at home? So the most important thing is to keep your child hydrated very well. So make sure you are giving adequate amount of fluid to your child who is having diarrhea. So what are the fluid types which should be given? It's not just water. That's very important to remember, because there should be some salt or electrolytes in the fluid that you are giving to your child. So the Jivani or the oral rehydration solution is the best at this situation, but you can also use alternatives such as Thambili or coconut water, soup, kanji, or any other type of fluid that the child likes to drink. Most of the time children refuse to drink, so it's very important to be persistent and then at least try to give in small quantities until the child is taking enough amount of fluid. Don't change the usual diet of the child. If the child is tolerating, give the same thing. Some important food stuff that you can give to your child safely during diarrhea include yogurts and curds and lots of fruits. But if your child is having a lot of loose motion, risking the child of becoming dehydrated or having vomiting, which makes you difficult to give adequate fluids, or having fever, it's important that you see a doctor to manage the situation. Thank you.